Hey, in this video, I'm going to give you my honest physical therapist review of Bengay Ultra Strength Pain Cream. Bengay is a water-based cream with the main active ingredients being camphor, methyl salicylate, and menthol. Bengay is marketed for use with muscle aches and joint pain. My name is Dr. David Midoff, and I'm a specialist physical therapist at El Paso Manual Physical Therapy. And this channel is dedicated to helping people stay healthy, active, and mobile while avoiding unnecessary surgery, injections, and pain medications. We make videos with advice, tips, exercises, and stretches for a variety of health problems. Please consider subscribing to our channel so that you don't miss out on any of the helpful videos that we post every week. Now, before I take this out and show you exactly how to apply it on your skin, which is pretty straightforward, but there's a few things to note. Let's just talk about the active ingredients. You can see on the back there, let me get the lighting better. We got camphor, menthol, and methyl salicylate, which I hope I'm pronouncing that correctly. Camphour's at 4%, menthol's at 10%, and methyl salicylate is 30%. Now, camphor is the main active ingredient in Tiger Balm as well. So what I like about Bengay is it combines several main active ingredients to make it actually quite powerful. And this ultra strength version of it is a little more powerful than obviously the main one. Now, camphor comes from a camphor tree. It's a derivative of the component in the camphor tree, and it's broken down and distilled down into camphor oil, and that's what they put in Bengay. Now, menthol comes from the mint plant. It's also broken down, and the substance menthol is what gives mint its odor and the feeling where it kind of tingles or burns on your skin a bit, and that's also put in here. Methyl salicylate comes from the wintergreen plant, and there's confusion during my research as to whether this is really a derivative of the wintergreen plant or if it's made in a lab, because it seems like they have come up with a way to make up methyl salicylate in a lab, so it's an artificial version of it. So I'm not 100% on whether this is 100% natural as far as all the main active ingredients go, or if methyl salicylate is one of the ingredients that is made up by scientists and put into this. Now, what you need to know about methyl salicylate is it has been connected to overdoses that have led to deaths, especially in athletes that have just put on way too much Bengay. Now, I don't think those people were following the instructions on the back here, which I'll detail for you in just a minute. But make sure that you're following the instructions. And if you have pain that lasts longer than the time frames they talk about on any pain cream, you need to go see a doctor, go get some help, figure out what the root problem of your discomfort is so that you're not in trouble or putting yourself at risk for something more serious as a side effect from even over-the-counter pain creams. Now, that being said, it's not like people are dying left and right from use of Bengay. It's actually a very widely used product that has tons of benefit for pain relief in the short term. And the side effects of it are probably a lot less damaging than medications that you take by mouth, even over-the-counter medications, because they're not getting all the way down into your organs as quickly as a by-mouth medication would get. And as far as research goes, I've linked research articles for each of the main active ingredients down in the description in case you're that nerd that likes to look at all the research stuff. What you need to know about the research is I have not found any research that combines all three main active ingredients as a formula used for pain relief. But I have found research studies for each of the main active ingredients as showing that it is effective. Each of the ingredients are effective towards relieving pain in the short term. But as a group used together, the way that Bengay formulates its product, I have not found any research. But you can kind of assume that if each of the individual chemicals can help to reduce pain, then probably all of them mixed together is going to be more effective. And as a physical therapist working with patients that have used this product, they all say that it's pretty effective. I've yet to meet a patient that has said that Bengay Ultra Strength didn't edge the pain a little bit, take the edge off, make them sleep a little better at night or get through the day a little bit better without having to ingest or take by mouth a pain medication. Now, your main side effect of Bengay is going to be skin redness. If you have some allergy or reaction to any of the ingredients in Bengay, then you might immediately get a rash-like appearance on the area that you put it on, or just some skin irritation, skin redness. And if that's the case, then you want to immediately stop using Bengay and talk to your doctor about your pain first, or find some other way to get some pain relief. Now, it says on the box that this is not for use with children 12 years and under. And of course, you should not be putting this on any body parts that don't have a muscle or joint on them. So make sure you're putting it on your arms, your legs. You can put it on your torso, anywhere that you've got muscles and joints. On your neck is fine, on your back is fine as well. You absolutely should not put this into your body in any way. You should not ingest this. This should not go in your eyes. It will burn tremendously. So be careful that once you've applied this on yourself, that you go wash your hands so you don't accidentally rub your eye or stick your finger in your nose or your mouth or ear or something like that, or any other body part that could be a very irritating experience for yourself. So now let's get into using the product itself. I'm gonna open it. This is a brand new one right here. So you can see the unboxing of this, and there's the tube of Bengay Ultra Strength Pain Cream. And on the back, we've got all the same label as we've got on the back of the box as well, the uses, directions. And the directions say to just apply some. It doesn't say exactly how much, but apply it to the affected area. And it says not more than 3 to 4 times a day. And after 7 days, if you still are having problems, you need to go talk to your doctor. So there's the limit on how to use this. Now, there's no like special cap to remove there, so that's kind of nice. I like that, but at the same time, I'm kind of thinking, well, you know, how sealed is this? But it was sealed in the box, so I know this wasn't tampered with at all. And I like that it's got this two-way cap, so you can unscrew it and get the little tube to go out that way, or you can just flip the top and get it to come out that way as well. And it's water-based, so that just means it should all evaporate from your skin. So there's the cream there, and it looks just like a lotion, and it's got a strong odor because of the camphor and the active ingredients, menthol, methyl salicylate. So you're gonna smell like this stuff, you know, once you put it on, but that's okay. You know, if you're dealing with a problem, then it is what it is. So you would just rub it into your body part that you have this, and just make sure that it goes away, that it is absorbed by your skin. That's what you're trying to do there. So once you rub it in, and when I say rub it in, you gotta rub, kind of almost massage the skin in the area and let it penetrate all the way. And you saw how much I put on. It was just a dollop. It was, you know, not more than, it was less than an inch for sure, maybe half an inch length of what came out of the tube. And there you go. So I've got just a little bit on my hand and just a little bit on my skin. So how we need to do next is go wash my hands so that I don't accidentally rub my eye or anything else, and get this off. And you know, I like the odor. It's kind of minty. Some people really don't like it. Some people don't mind it at all. If you're dealing with any sort of pain or ache, it makes a difference for sure. And like the directions say, you might need to put this on a 3rd or a 4th time throughout the day. Just don't go past that amount. And if you're still dealing with problems after 7 days, you have to stop. Now, let me give you my honest physical therapist review of this product. Now, if you're in a lot of pain, if you're dealing with back spasms, arthritis pain like knee arthritis, hip arthritis, if you're dealing with foot, wrist, hand pain, especially in the arms and legs, this stuff penetrates pretty well. As you saw on my wrist here, you know, skin tends to be a little thinner on your wrists, hands, ankle, and feet, so it penetrates extremely well in that area. And you instantly, I mean, within a minute or so, start feeling the little numbing effects, the little tingly effects of it, and it changes the sensation that you're getting into the area and makes it feel a little bit better. Now, you just have to have a clear understanding that this is not going to solve your problem. If you've got arthritis, for instance, it's not fixing your arthritis. It's just taking the edge off so that you can get a little more comfortable and maybe sleep better or rest a bit so that you're not in constant pain and in constant discomfort. I especially like this if you have any sort of stomach reactions to like ibuprofen, any sort of NSAID, non-steroidal anti-inflammatory drug. This does technically have an NSAID in it. The methyl salicylate is classified as an NSAID, but this doesn't go into your stomach right away. Technically, it can circulate around your system, but the dosage is relatively low compared to taking ibuprofen, and that goes directly into your stomach, so it can really irritate it if you've got a reaction to ibuprofen. So overall, I like it. It's just not a good long-term thing. It's a short-term thing. You know, if you sprain something, if you just take a bad fall, or you wake up stuck in your back or joints somehow, this could be something to get you through until you can see the doctor, or until that sprain can just calm down so that you're not in constant pain. I would definitely recommend keeping this in your medicine cabinet or wherever you keep some medications as an alternative. I would put it right next to the Tylenol, ibuprofen, and consider using this first if possible, so that you don't have to take a pain medication by mouth. Now, one thing I didn't mention that I don't want to forget is you can't put this on open wounds. So if you scrape yourself or you cut yourself somehow, this is not something you're going to use. You're going to have to suck it up, or consider taking by mouth pain medication if your pain is that bad. Now, if you're looking for other alternatives for pain creams, we've reviewed several here on our channel. If you go down into the description below and find our products reviews playlist, you'll find other creams that we reviewed. We reviewed stuff like Blue Emu, BioFreeze, Voltaren. There's a bunch of other ones in addition to other products that we reviewed on here for pain relief. Go check those out so you can learn more and see which one is best for you. Thanks so much for watching, and we'll catch you in the next video. Bye-bye.